Hi everyone. Thank you very much for taking a few minutes to listen to our video. We're going to speak for approximately 5 minutes. And we think we have a message that may be of some value to you, and we'd like to pass this on. What we're going to talk about then is called non-melanoma skin cancer. And while these words may be new to you, it represents the common types of skin cancer that we see each and every day in our dermatology practice. Our practice is called the Skin Cancer Centers, and we specialize in the diagnosis and treatment of skin cancer. When we talk about how common skin cancer is, we want to put this in perspective. Skin cancer affects 20% of the U.S. population. But if we decide to subdivide that and pick a group that is A, fair skin, and B is over age 65, we find out something that's very interesting and fascinating, and I think probably something you don't already know. And that is that at least 50% of patients who fit within this category will end up developing one, or in some cases, several skin cancers. If we then subdivide the group further to choose people who've spent a lot of time outdoors, playing golf, swimming, etc., or have an occupational exposure, or were born in Florida, we find out that this number in some cases goes up as high as 70%. So, interesting fact, if you're over 65, if you're fair skinned and have some history of significant sun exposure, you may develop a skin cancer, so listen on. Okay. How do we know whether or not you have a skin cancer? We find out something else very fascinating, which is that 60% of patients who eventually are treated for skin cancer do not know that they have the skin cancer. It's diagnosed by a dermatologist because they're having a general skin exam. Frequently, the skin cancer, unbelievably, is on their face. So even though it may be of significant size, the patient is still unaware of it. As you listen to this, you may say, that's interesting, I didn't know that before. Well, what can I do about it? The answer is you can have a very valuable diagnostic test performed, and that's what I want to talk to you about. As a background, let me begin by saying that different types of common cancer, and again, I'm not talking about skin cancer now, but cancer in general, have specific, we call them screening tests, that are used as a public health tool for early diagnosis. For example, breast cancer is diagnosed by a mammography, whether it be a digital mammography with an ultrasound, etc. Colon cancer is diagnosed via colonoscopy, an extremely valuable tool that saves thousands of lives every year. Prostate cancer, likewise, is diagnosed by a blood test. Now, I say to you, have you had the standard screening test for skin cancer if you're fair-skinned and over age 65? And frequently, I find patients say to me, Doc, I don't even know what the standard screening test is. So we're here to tell you that it's a very simple but very valuable tool, and that is to have a comprehensive skin cancer screening exam. The problem is this is not well recognized by the population, nor is it well recognized by primary care doctors. We rarely see a patient referred to us by a primary care doctor for a skin cancer screening examination. Consequently, what we do is to offer our patients a free, comprehensive skin cancer screening exam with the express purpose of looking for skin cancer. This is not covered by insurance, and therefore we offer it without charge. If we do find something that we think is very important, obviously we're going to tell you about it. You then have the choice of seeing your own dermatologist, or if you wish, we'd be happy to perform a biopsy at the time that we do our examination. So again, skin cancer is pretty darn common, unfortunately, especially if you fit into a certain subsection of the population. There is a valuable test that you can take advantage of to find out whether or not you have skin cancer, and we urge you to do so. Thank you very much for listening to our talk. I would love to have you come to a more expanded talk that we give in our office. It takes about 20 minutes. We provide a free buffet, and we're able to answer your questions and to give you more information about what skin cancer looks like and what kind of treatment. Please call us. You can reach us at 634-1455, 782-2165. Call, tell our appointments clerk that you'd like to make an appointment either for a free skin cancer screening exam or for our free buffet. We would love to hear from you. Thank you for listening to our little talk.